Welcome to The Explainer. Today we're tackling something pretty important, a super common surgery that can give you back your sight, but, and this is a big but, might also come with a hidden risk way down the line. So let's get into it. So maybe your doctor told you that you have cataracts and age-related macular degeneration, AMD for short. Well, if that's you, trust me, you are in a lot of company. And having both of these conditions puts you right at the heart of a really big debate in eye care. The question is, will the surgery that fixes one problem, the cataracts, end up making the other one, the AMD, worse? It's a tough spot to be in, so let's really unpack the evidence on both sides of the argument. All right, first up, let's talk about the promise. The upside. Why do doctors recommend this surgery so often? Well, the evidence here is really strong and super consistent. Okay, check out this number. Plus 11.2 letters. What does that even mean? Well, it comes from this huge, really important study called the Age-Related Eye Disease Study. You'll hear it called ARDS. And what they found was that people with mild AMD who got cataract surgery could, on average, read more than 2 full lines further down the eye chart. I mean, that's not just a small tweak. That's a genuinely life-changing improvement. And listen, it's not just about acing your eye test. A huge Cochrane review, and those are kind of the gold standard when it comes to medical evidence. They confirmed that patients themselves, in their own words, report a much, much better quality of life. It's about how they feel they can see the world. Yeah, the benefits just ripple out into everything you do. Think about it. Colors look brighter, more vibrant. That annoying glare from headlights when you're driving at night, way less of a problem. And just simple things like reading a book or seeing road signs become so much easier and safer. So this is the promise, right? The clear, proven upside. Okay, but now let's flip the coin. We have to talk about the other side of this debate. This is the big question, the concern that has driven researchers for decades. Does all that amazing, immediate improvement come with a hidden price tag? Something you only have to pay years later. So where does all the confusion come from? Well, it's pretty fascinating, actually. It's because we have 2 different types of scientific studies that are giving us 2 totally different answers. On one side, you've got these tightly controlled clinical trials, like that ARID study we mentioned. And in those, they don't find any clear risk. But then, on the other side, you have these huge population studies. They just watch thousands of people living their normal lives over many, many years. And those studies, they consistently find a connection, an association with a higher risk of serious AMD down the road. And when you actually look at the numbers from those big population studies, they're pretty hard to ignore. We're talking about major studies, from the Beaver Dam study in the US to the Blue Mountain study all the way in Australia. And the results keep pointing in the same direction, a risk that's 3, 4, even almost 6 times higher for developing late-stage AMD years after having cataract surgery. Okay, so what are we supposed to do with this, right? We have one pile of evidence saying, go for it, and another saying, hang on, be careful. How do we possibly reconcile these 2 things? Well, as always, the devil is in the details, and that's where we can start to find a path forward. And here is a massive clue. It's all about the timeline. When you look at multiple big analyses of all the data, a pattern shows up. In the first 5 years after the surgery, nothing. No statistically significant increase in risk. But then, after that 5-year mark, that's when a clear, measurable risk starts to appear. It's like a slow burn, something that builds up over time. So what could this slow burn process actually be? Well, the first leading theory is something called phototoxicity. And here's a simple way to think about it. Your eye's natural lens acts like a pair of built-in sunglasses. It's been filtering out a lot of that intense, high-energy blue light your whole life. When surgery takes that lens out, your retina, the sensitive part at the back of your eye, is suddenly getting hit with way more of that light, day after day, year after year. And that can cause oxidative stress, which we know is a major player in AMD. The second big idea has to do with inflammation. Look, any surgery is a trauma to the body, and it triggers an inflammatory response. That's normal. But if your eye is already fighting the chronic low-level inflammation that comes with AMD, that big spike of inflammation from the surgery could be like throwing gasoline on a smoldering fire. It might just be enough to kick the underlying disease process into a higher gear. Okay, so if one of the big theories is about too much blue light, you can probably guess what happened next, right? Technology stepped in. And that brings us to a really key innovation, the blue light filtering intraocular lens, or IOL. It's basically a replacement lens that tries to mimic that natural sunglasses effect. But this is where the science gets super, super specific and really interesting. So, do these special lenses prevent you from getting AMD in the first place? The studies say no. They don't seem to stop new cases from developing. But, and this is a huge but, what if you already have some damage, a type of dry AMD called geographic atrophy? Well, in that case, they seem to make a real difference. One study found that after 8 years, the area of damage in patients with these lenses was 40% smaller. So they don't prevent it, but they might slow it down if it's already there. See? It's nuanced. So you can see why the official guidance from groups like the American Academy of Ophthalmology isn't just a simple yes or no. It can't be. It's all about a risk-stratified approach, a careful weighing of the pros and cons for your specific situation. If your AMD is in the early stages, the huge benefit from the surgery probably outweighs the small long-term risk. If your AMD is already very advanced, maybe the surgery won't help your vision that much anyway. And if you're in that middle intermediate stage, well, that's where the conversation with your doctor becomes absolutely critical. All right, that was a lot of information. So let's boil it all down. What are the key takeaways you really need to have in your back pocket when you go talk to your doctor about this? Okay, here's the bottom line. First, the visual benefit of getting cataract surgery is real, it's immediate, and it's often huge. That's a proven fact. Second, the idea of a long-term risk is plausible. The evidence is there, but it seems to only really show up 5 or more years down the line. Third, and this is the most important part, this decision is incredibly personal. It all comes down to your stage of AMD, how bad your cataract is, and even your age. And finally, you absolutely should be asking about those blue light filtering lenses, especially if you already have some existing atrophy. It's a key part of the conversation. So, at the end of the day, the goal here wasn't to tell you yes or no. It was to arm you with the information you need. With the benefits clear and the risks in focus, you can now walk into your doctor's office and ask really smart, targeted questions to figure out the absolute best path forward for you.